Droopy eyelids is a fairly common problem with aging. Fox 26's Melissa Wilson explores the ways you can repair the problem. We have more.
Dale wants to know what to do about drooping eyelids, and sometimes it's more than a cosmetic problem, isn't it?
Yeah, you know, sometimes it's just when you look in the mirror and you think, all of a sudden I woke up one day and my eyelids were heavy. Other times it can actually obscure the vision, and you can look at someone and see that their eyelid is hanging into their line of vision.
Let's talk about what you can do as a dermatologist. You have some pictures here that gives us an idea.
Now we have amazing new treatments like Ultherapy. So Ultherapy is an FDA-approved treatment. It's actually ultrasound energy, which heats the deeper layers of the skin. There's no cutting of the skin, there's no surgery, and within about 3 months you can see a significant lifting of the eyelids. We even have patients after treatment immediately notice lifting.
Okay, now, but there are some patients who wouldn't qualify for this because they just have a more severe case.
Right. When you have more significant skin, so in someone who's maybe 60 and over, who has a significant amount of tissue redundancy in the eyelids, someone who has a lot of sun damage and laxity, really they need a blepharoplasty, which is a surgical procedure.
And you have an example of that. Your patient Dale is here. Hello there.
Hi, Mrs. Westbrook. So if you look on Miss Westbrook, she'll even tell you, you know, the skin of her eyelids is very redundant, and it's so redundant, in fact, that she told me it was obscuring her vision.
So it affects you a lot.
No, yes, a lot.
In what way?
Well, now that I'm looking at you, you can see my forehead is picking my eyes up so I can see you.
Mm-hmm. So you have to really work hard to lift your eyebrow.
Yes.
It's just exhausting.
It is exhausting.
Yes, you told me you had to lay backwards with your head sometimes to even read.
At night, I go to bed because the TV is on the wall, and I don't have to. I just lay there and look through those little slits.
Mm-hmm. But you want to try to do something about it.
Yes, I do.
Right. So in a patient like Miss Westbrook, what she needs to do is actually be seen by a plastic surgeon, an oculoplastic surgeon, or a derm surgeon who's board certified in blepharoplasty.
All right. And then if you're interested in doing a procedure like that, then best to talk to the surgeon first and decide, I guess, if you could do something like Ultherapy that's less invasive.
Absolutely. You know, really, if it's mild or if you just want prevention, I tell patients, you know, using topical products that are firming around the eyes is fine. You want to look for products that are gentle enough to use around the eyelids, but there are products containing retinoids, containing peptides that firm the skin that you can use in your younger years. Of course, sunscreen is the best prevention. And then as you become a little bit older, the tissue becomes more lax, non-surgical procedures, even a little Botox in certain areas can lift. Eventually, once the skin obscures the line of vision or it's too heavy or thick, surgery is the best option.
All right. Thanks, Dr. Ingraham.